If you were to take all the blood vessels in the human body, join them, they will be able to make the circumference of the earth 2.5 times. 66,000 miles. Each of those cells that line the inside of your blood vessels are known as endothelial cells. And those are the cells that are responsible for something known as vasodilation and vasoconstriction. So vasodilation is your blood vessels opening, vasoconstriction is your blood vessels closing. Now the thing is, there is something known as nitric oxide. Nitric oxide is a gas that is produced in those endothelial cells, and they are responsible for a healthy cardiovascular system. So it means if your nitric oxide levels are as they're supposed to, you cannot get a heart attack, you cannot get a stroke, you cannot get hypertension, you cannot have a cardiovascular accident. It is impossible. So the thing is, why do we have all these people getting strokes, heart attacks? You know, hearing about, you remember they used to be talking about Alzheimer's? When last year people talk about that? They have something now called vascular dementia. Fancy name, you know. But what vascular dementia is when you lack or you're not getting sufficient blood and oxygen to your brain. People who have Alzheimer's, when they examine the brain, a brain CT, what they see is plaque in the blood vessels of the brain. So it means that when you're not getting sufficient blood, you're not getting sufficient what? Oxygen and nutrients. That is primarily the main purpose of blood. That particular product, Bcardio, we had nice. Good. So this is what it looks like. And this company is very smart. I'll tell you why. They made sure and did these products in a way that is very easy. Because you could take this, you take out a pack, you carry it with you. So while you're on work, whatever you're doing, you're going to take a run, whatever the case may be, you could use it. But let me tell you what this product had the ability to do. That same diabetic, I was working with someone with diabetes, and this person had type 1 diabetes, which means they are insulin-dependent diabetic. Good? They had problems with loss of vision and that type of thing. Because I said diabetes is very oxidative. It causes high inflammatory response in the body. So what we decided to do, and the particular product had this same ingredient profile, which is L-arginine and L-citrulline. That is basically amino acids. So you have a precursor to nitric oxide. But in using this, by the time we reached 30 packs, because what I did with the individual, I told them to drink 2 packs a day. And they had to do that for me for a month. The results that we got and saw with that individual, we were actually able to wean them off of insulin, one. We also saw a significant improvement in eyesight. They had something known as diabetic neuropathy. Anybody know what that is? When you get diabetes, because it interferes with the circulation, it interferes with your nerves. So what diabetics get is something known as diabetic neuropathy, which is nerve damage as a result of diabetes. And in this particular patient, in just 1 month, 2 sticks a day, we were able to see a significant improvement in that. And the blood sugar levels, as I said, we are actually able to wean them off of insulin. Do you know what insulin does to the body? Anyone? So insulin is a hormone that is responsible for regulating blood sugar levels. But when you are diabetic, taking insulin shots is very detrimental to you. And the reason for that is the constant very highs and very low. Because you see, the way the human body is designed, usually if it's based on a ratio. So let's say the ratio is 1:1. So for every 1 sugar you use, or every 1 sugar that your body has, let's say you have the equivalent of 1 insulin to balance off that sugar. So the ratio is a 1:1 ratio. So it means if you have 100 sugars, ideally, you will basically need 100 insulin to balance that. You all follow me? Good. The thing is, with someone who takes insulin, that doesn't happen. Because remember, you're taking insulin now with the assumption or the hope of the amount of sugar that you have in your body. You can't accurately detect that. So that is why most of the time when they give you insulin, they give you a kind of guess situation. So they tell you, okay, you might take 10 units in the morning, 15 units in the night. But the point is, because of taking the insulin like that, so let's just say you take 15 insulin, but your sugars is 30. It means that your ratio off there. You understand what I'm saying? And let's say it's the next way. Let's say you have 100 sugars. So in that particular case, you need 100 insulin, but you only take 50 insulin. So it's always off. So the problem with diabetics who are on insulin, that constant high and low, high, low, causes serious damage to the body. It damages your eyesight very quickly. So if you're a diabetic and you're taking insulin, in about 5 years, your eyes mash up. There's a situation known as diabetic neuropathy. That's bleeding in the back of your eyes. Now think about it. There is connectivity in the back there, and if it is, you end up with blood pooling at the back of your eyes, you will eventually end up blind.